Second is that how do you feel that there should be no difference between the infrastructure, faculty and teaching between India and any other part of the world, so that when they come over here, they should be not only eligible. How does the regulations ensure that the campus and on-campus studies are at par not only with India but with any other part of the world? And third, which she can answer all together, and the third is that when you look at Uzbekistan, I know this is the government's requirement, but does NMC also see the safety of Indian students and what kind of an environment are they living in?
Yeah, thank you so much. At the outset, let me thank ma'am and the organizers for giving me this opportunity to interact with such a crowd, that too in presence of Dr. Joshi sir. I like to say, before I start answering questions, I have to tell you that India today is not the same India which it used to be in 1947. If I need to describe what it is today, then I like to borrow the title of a book by the Prime Minister and President of Israel, Shimon Peres, and it is No Room for Small Dreams. So that is what India today is, and I believe this NMC, National Medical Commission, was part of that plan to replace the older version of it and come out with a new body which represents not only today's India but the reality of the world now. We have to keep pace with the changes, that's why NMC came into being. Now coming to the question which Madam asked, lots of 3 questions actually, so I'll try to answer one by one. In NMC, first we decided it's the vision of the Prime Minister of India to have a number of seats in this country. And along with that, he was very particular that we should not make compromises with the quality of education. And when we looked at it, we came out with the regulations. I think the FMG regulations are the smallest or shortest regulations, 5-page regulation. Only few things added to what was earlier there, but they are very important things. And all of you must be knowing that one of them was medium of instruction should be English. And then second was like, you have to have the same curriculum which we teach to our student, because we expect the student to come back to India, pass an exam, obviously for the quality purposes, and then be a registered medical practitioner here. So if we want a doctor to practice in India, he should be exposed to a curricula outside also, which is there in India. That was one, and it's a very good curricula. We are producing best of the best doctors from India, and our doctors are supposed to be the best in the world. That's what the thing is. And the next thing was like, it has to be for the same duration of time, has to be like that, whatever is there in India, because when you go to another country, you take time to learn language also, some 6 months, some 1 year. So if you add to that and you try to complete that course, so you cannot have a shorter course outside, and you know that was the another thing which we had in our mind when we formulated these regulations. And again, like, do we have these NMC compliant and kind of things? I believe no. We do not do these kind of things, that the so and so medical college outside the country is NMC compliant or not. But we expect the college or the university to be NMC compliant. That is another way, but we do not certify a college or university to be NMC compliant. Another thing about like security, every time, every year actually, we are telling the students, because if you ask me, it will take another 1 day of workshop or seminar here to tell me the problems which FMGs faced, some genuine problems they face, because they were not guided properly by the person who sent them outside. So because of that, every year till I was there in NMC, every year we used to come out with an advisory to the students that if you are going outside, please confirm these 2-3 things. Please see that whether you have gone through, your parents have gone through the regulations, whether the university will be teaching you in that way. And the last and most important thing I am telling you, which was not there in the presentation also, it is that we were very sure about of one thing, that if a student is going outside the country and that country is producing a doctor, then why that student should not be able to practice in that country? So that is why we have made it mandatory that if a country in this world wants to produce doctors, they should allow them to practice in their own country also. So the vision behind formulating this regulation is the vision that obviously which we talk of global citizen, and obviously the vision of partnership and collaboration. These are the buzzwords now also, which I think are reflected in Vasudhaiva Kutumbakam. And last, I want to say, in India, education means, and the objective of education is Sa Vidyaya Vimuktaye. Means the whole purpose of education is towards moksha, nirvana, or whatever we want to say it. So, in last, it's very important that the education which we give inside India or outside is holistic. In India, we try that, and we have come out with a EdCom module. All the teachers must be knowing it. That is related to more of ethics, inculcating more of ethics into the doctors, having more communication skills into the doctors. And I hope that those students who are studying outside has exposure to ethics and communication. And last month, we thought that if a student is studying outside and he wants to come back to India after passing an exam, then he should have exposure to this, not only the healthcare of India, but also the kind of patients we have in India. For that, we have said in the regulation that he will need to do another year of internship. Not to penalize them. This is not the objective behind it. The objective is to have that student exposure to the patient, kind of patient we have, the kind of healthcare we have, because it may differ from one country to another. That was the vision. I hope I have answered all those questions, ma'am. But as I said, FMG was the kind of what should I say? I should not say headache, because
passion for you.
yeah.
But this workshop,